So help us understand MJH and especially sort of the new MJH in the context of the broader industry. There are other players here, sort of vying for those same eyeballs, for those same advertisers, for that same business. Where do you fit in that spectrum? I mean, WebMD obviously is one, and again, another private equity backed concern there. Help us understand the landscape.
Yeah, so I guess the first part of the question is, who is MJH? Not a lot of folks have been familiar with us. We've kind of flown under the radar screen and really have kind of popped up over the last 3 years in terms of growth. Our business model is structured in kind of 3 core areas. We have our market research entity, healthcare research analytics, actually acquisition that DeSilva+Phillips worked on us with. They work with the pharmaceutical, biotech, med device companies as early as phase 2, 3, 4, 5 years prior to launch. Then we have our educational arms, another acquisition that we made, Physicians Education Resources, hitting the healthcare professional, got our start in the oncology landscape, and then we developed it and moved it outside of oncology to hit multiple specialties within the physician landscape. On the flip side, we have another med ed company, Pharmacy Times Continuing Education. They hit the other healthcare professionals. It's not just about the physician today. You have to hit the payer, you have to hit the pharmacist. So we're making sure that we're hitting all the key demographics that our pharmaceutical customers are looking to target. And then we have our media communications arm. That's where we got our start. That's what we're rooted in. So we have some brands that we've kind of grown organically throughout the years and some acquisitions. So brands that most folks are familiar with are in Enclive, American Journal of Managed Care, Pharmacy Times, Cure Media Group, all kind of household names that we've either acquired or built.
I like kayaking in sunsets, and I would love to be healthier, so I should have this drug, right?
Why not?
Yeah. So then how do you, so what's the answer? How do you actually get to ultimately those consumers in a way that gives them an opportunity to ask the right questions and to ask the right questions about the things that might actually be useful to their health?
Yeah, so Cure is the one property that focuses more on the patient, our consumer arm. So for us, it's trying to provide our audience with the most meaningful education out there so that when they are having that conversation with the healthcare professional, they're truly armed with facts and not just the kayaks and the nice rivers that you're talking about. So we want to create an educational opportunity to give them the dynamics of that market, what they should be looking for, and the questions that they should be asking rather than saying, this is something that I think I should be on.
Right. And so how do you use technology in that regard? Because I would imagine that you're able to sort of leverage some existing technologies, some around the corner technology to arm them a little bit, right?
Yeah, so for us, obviously the digital is one opportunity that we've kind of grown quite a bit throughout the years. Just looking year over year, digitally we're up 30%. So more and more consumers are there, familiar with the brand. So how exactly are we educating them from a consumer perspective? It's these videos. It's that peer-to-peer type of education.
Yeah.
You want to hear from somebody else that's going through something similar to you are if you're a consumer. And if you're a physician, you want to know ultimately how these top healthcare professionals are treating their patients. Because a lot of these community docs today are really a lot of the community docs today are forced to do a lot of this back-end information and don't have the opportunity to be as educated as they once were. So we're trying to bring it to them in that on-demand type of setting.